Stokes, and I am the Substance Use Disorder Program Coordinator at Ellenville Regional Hospital. I am also the Ulster County Family Advocate. And Danielle and I are, we oversee the Ulster County MOUD list, which is medications for opioid use disorder. This list was brought to us by, we thought of this list with the HEAL study in our MOUD work group. And at first it was a PDF of just like a very unattractive list of providers in Ulster County that provide MOUD. So instead of sending that out every month, I decided to take all that information and put it into a website. And also it has Google Analytics, so we're able to see how many people go to it each month or each week or each minute. So it's really interesting. I'm happy to be a part of this today and be able to show you around the MOUD website. And feel free to ask any questions or like any like hypothetical questions, like, okay, if this person walked in and they needed this, like how would I navigate the website to find the most appropriate care for this person? So feel free to ask questions like that too. So I'm going to share my screen. So this is our Ulster County MOUD list website. It is a Google site, so some people have issues with accessing it, especially through organizations. Firewalls tend to block it. So I know for us, we have to log in to our firewall to see it. So that's something to keep in mind. I have had people reach out to me and they're like, no, it's down. And I'm like, no, your organization might just block it. So you might have to access it through your phone. Very pretty picture of Ulster County in the fall, appropriate. And again, this is a one-stop shop, a comprehensive list website that carries all the Ulster County providers who prescribe medications for opioid use disorder. So we're talking Suboxone, methadone, Vivitrol, Subutex, Sublocade. Those are all things that you could find on here. And as you'll see, as we go through the tabs, it's going to tell you type of insurances that each organization accepts, certain details about the organization, whether it's low threshold or not. Just these very small details, but very significant details. Again, there is the fall background. A little bit about what this website is about, and then also the HEAL campaign. These videos are on every page except the NARCAN training tab, and links to the HEAL study and also Ellenville Regional Hospital. So this website is broken down into different categories. First, we start out with hospitals that are in Ulster County that offer MOUD. So Ellenville Regional Hospital, this is us. We have Health Alliance, which is Bridgeback. Right now, they are not offering Suboxone, but they do offer, I believe they offer Vivitrol, yes. And then we have the methadone program. And you could see if you hit this little arrow, it'll show you maybe a direct contact. There are certain places like Institute for Family Health, you can have a direct contact so you don't have to sit in the call center. Certain details like they will provide bridge prescriptions, depending on the circumstances, type of insurance that we'll take, the providers that we have on staff, and just other information. So we'll help with locating treatment, we'll help with applying for insurance, those kinds of details. And like if you look at the methadone program, you'll see that it'll say that there's currently a wait list, but then it'll also list links to other methadone programs in the Hudson Valley. So again, a one-stop shop for all your MOUD needs. A lot of, from what we were seeing when we were putting this list together, like there are certain medical groups that we didn't even realize had buprenorphine providers, such as like First Care Medical Center. And there was another one. But it was up in Saugerties. It's no longer, they don't have a provider there anymore. But it has this website has MOUD providers all over Ulster County. So from Highland to Kingston to Ellenville, there's someone in New Paltz. So it does cover all the county. And again, we have, what they provide, like First Care Medical Center provides Zubsolv, which is another form of buprenorphine. You don't see that with a lot of places. Whether they're accepting new patients or not, what their hours are, links to their website. And then again, the Institute for Family Health, I always put a plug in for the Institute for Family Health, because they do have a direct line to their SUD care coordinators. They have one in Kingston, one that covers Kingston site, and then one that covers the New Paltz and Ellenville site. And you can contact them directly, Gina or Julian, and they'll be able to set up your client or your patient with an appointment for medication-assisted treatment. And that's always good to have, those phone numbers to give to clients also, so they don't call the call center and have to sit there for 45 minutes. Like, people really like having that direct line. I always like having a direct line. So also, if you look at Sun River Health, Sun River Health is at Ulster Avenue, which I believe is where HealthQuest is, right? And they are a low threshold program. So they don't need any established primary care there. The Institute for Family Health does. But again, it shows you which days they're open, if they're accepting new patients, the different insurances they take. Organizations. These are all different organizations that either provide supportive care for people with MOUD or on MOUD, or that do MOUD. So Catholic Charities Cody program, although they do not provide medication-assisted treatment here in Ulster County, they do have a site in Monticello and all over the Hudson Valley. So this has all of their contact information for their different sites in Sullivan, Orange, and Ulster. They also have a peer advocate in Kingston now, so they're able to connect individuals to their Monticello clinic. Hudson Valley Community Services, yes. We have their website and their phone number and a bit of the different services that they offer. We have Samadhi, which offers the same thing. The services, phone number, websites, and then also Step One. And then we have private physicians. So these people are mostly people who do not take Medicaid. Many of them are either out of pocket or private insurance, like the Grovenbergs who are in Kerhonkson. But they do offer Sublocade. So that's something important to know, because Sublocade is the injectable. Lichtenstein's, his practice does accept Medicaid and Medicare, which is important because not a lot of people accept Medicare. And again, people all over Ulster County. And some of them actually do, some of the listings do have the amount that it is out of pocket. So one of the newest features of the MOUD website, which is one of my favorite features, is the live NARCAN training calendar. So this actually just went live in the past week. Organizations in Ulster County can submit a form that just provides information of their upcoming NARCAN trainings. And we will list it on this live NARCAN training calendar that people can access, the public can access. Right now, we just have one because I was just testing it out. But it's really exciting. It's going to be another one-stop shop, one place where people can go to access any information about upcoming trainings. And then our last one is our contact page. We have a place where people can ask a question. So they just, do you know of anyone? Sometimes we get questions about like out of county. So do you know anyone that provides MOUD services in Orange County? And then also if there's an MOUD provider, because all this is a comprehensive list. People are getting waivered all the time. People are starting to provide MOUD all the time. We might miss someone, or maybe some of their information has changed. So then they can come right here and fill out a form to either add their information or to edit their information. And then I was able to check this, Jillian. There is a search option. So let's see, HPCS. I keep looking at HPCS because Cam is right in my screen. So HPCS, we could search that and it comes up to this. MVP, let's see. We could search MVP insurance. It doesn't come up to the actual where they are, like the actual tab, but it'll bring you to the category that it falls under. And that's really it when it comes to the MOUD website. I would love to answer questions if you have any.
Tanya, we got a question in the chat asking how often the site is updated regarding the wait list.
So this site, Danielle contacts everyone on the site once a month. Since we are also very involved in a lot of the different initiatives, it's kind of like if we hear something, we'll update it too, like before that once a month time comes. So, it's constantly updated, constantly. I just updated this picture, I think last week.
Awesome, thank you, Tanya. Does anyone have any other questions?
I don't have any questions. I just want to commend you and thank you for creating this, because I think this is a great resource and seems like it will be easier to navigate than a lot of other, resource locations that are kind of in that list format.
Yeah. Thank you.
Yeah, just yesterday I was trying to find some place for Suboxone and I had to call 4 or 5 different places and we ended up just sending the person over to the hospital. We couldn't find anybody. So thank you. This is fabulous.
Wow. That's awesome. Yeah, I'm happy you'll be able to use this. And just so everyone knows here, I got to just do a little plug for Ellenville Regional Hospital is that we offer buprenorphine inductions in our emergency department. So if someone is in active opiate withdrawal, they can come right to our emergency department and be prescribed Suboxone, and then we will connect them with a treatment provider within 3 days. I always
24/7?
Yes. Yep. They come right to our emergency department.
Cool.
I always suggest that someone calls us because since, we are far out there, we want to make sure that people are they fit the right criteria, but they're always more than welcome to come 24 hours.
Scott is asking, well, first of all, he says the website is amazing, but he also wants to know, how do you go about getting your organization added? So he's saying he wants to get the Independent Living Inc. SOR2 recovery added.
I'm pretty sure that you could actually just add it. If you go to the contact page, you can add that information, or you can just email me directly and we can put it up there. And if you want to email me, if you could just put it in that format and just write a brief description of your services, that would be great.
Yeah, I just want to add one thing. So because this is part of the Healing Community Study, we're taking back a lot of data from all of the strategies that we're implementing. So if you could foresee yourself using this list quite a bit, it would be really awesome if you could share some data back to us. I'm actually going to try to share my screen, Tanya, and show a very easy form that Tanya created to gather some data. So if you're interested after seeing the form in submitting data back to us to help us see the impact that it's having, that would be amazing. So it's a very easy Google form. It just asks for your organization, how many individuals you've linked to MOUD providers from the list. Now this is a monthly reporting form, so if you linked 3 people, you would just put 3, and it gives you up to 20. And then we're also trying to get some race data as well to find out who we're linking. So we've got a section for the amount of Black or African American, Hispanic or Latino, white, and multiple ethnicities. So this is really helpful in us not only to see how helpful the MOUD provider list is in getting people connected, but also continuing to see the populations that are being affected by the opioid crisis, which is really important information to have when you're out there doing the work. So if you could foresee yourself using this list and would be interested in submitting data, just let us know and we'll make sure we get this form to you. We would hope that it wouldn't take too much time, but again, it's voluntary, so we're not forcing you to do this, but if you can, we would be eternally grateful. And if you have any other questions in the future, feel free to direct your questions to Tanya and myself. I can try to help, but Tanya, I think, is the expert on this one. And if you hear of anyone who is an MOUD provider but is not on the list, please, if you could send that our way, that is immensely helpful. Tanya, do you have any last notes that you want to say before we head off?
I do not. I do not. I was just saying that, yes, if anyone has, if anyone knows of anyone else, if you're looking through there and you're like, oh, you don't have this person, definitely let us know. And we will either, contact them or add them to the list.
Yes, and I'm going to throw this out there as well. Tanya, correct me if I am wrong, but if you have any suggestions on how to make the website more efficient for you, send that our way as well. Ellenville is constantly working on this website. Tanya and Danielle, you put so much effort into this, so you're always in it. So if you have any improvements, let them know.
And when it comes to when I was thinking of this website, I took basically the information that I was getting from the people that I worked with, what people were finding to be the most, what people were finding as barriers. And what I wanted to add to the website were, insurance, transportation, low threshold. These were all important to people, important things that they were seeking. So if you look at this website and you're like, what would be really beneficial would be this for people, feel free. I'm totally open to it because I want to make this as easy as possible for people.